And good evening, everyone. Welcome to the fourth in our series of 5 webinars, Talking PF, organised by Action for Pulmonary Fibrosis in collaboration with Boehringer Ingelheim. I'm Louise Wright, I'm Chief Executive at Action for Pulmonary Fibrosis, and I'm moderating this evening's hour-long webinar. The aim of the series is to provide a range of mini talks and live Q&As about lungs, life and keeping strong. We always have great speakers lined up who are primed to present in ways that are clear and jargon-free, and tonight is no exception. And most of you will know APF is a patient-driven charity, and these talks were developed with patients and families. And who knew, but this week's webinar is very timely because it's Pulmonary Rehabilitation Week. And I'm delighted to introduce Lorna Brown. Lorna has worked as a physiotherapist in respiratory care for many years and started the Pulmonary Rehabilitation Service at Papworth Hospital in 1997. And PR is something she feels passionate about. Lorna, but will be alongside Ron. And Ron was diagnosed with familial IPF in 2015. He is a much valued support group leader and is a keen advocate of pulmonary rehabilitation. And I'm aware that many of you watching may not only be wanting to know more about PR, what it is and why it's beneficial, but also how to access it. And I know many of you would have tried to get on pulmonary rehabilitation courses with little or no success. And whilst there is growing recognition and an appetite for pulmonary rehab to be made more easily available to patients with PF in the future, what can you do now? And so we've updated our webpage on pulmonary rehabilitation on our website with some tips of what you can do. So I'm going to go back a slide and just talk through quickly the legalese. Information provided at this webinar is not intended to replace advice from your doctor. Medical matters should be discussed with your doctor and specific medicines will not be addressed at this session. We would love you to post your questions in the Q&A box at the bottom of the screen, and you can start asking those questions. Keep them clear and concise, and if there's a particular person you want me to ask those questions of, then do let me know. And there's technical queries, so in case your sound goes or something's not working, there is a chat function, again, at the bottom of your screen, and somebody who's magical behind the screens here will help you. The Talking PF webinars are a collaboration between Action for Pulmonary Fibrosis and Boehringer Ingelheim, and BI kindly provided the funding and support in line with the ABPI Code of Practice. But before I hand over to Lorna and Ron, we've got a couple of polls that will help us find a bit more about you. So Chris, I'm going to ask if a poll will pop up and just ask you to let us know if you're a carer, a patient, perhaps you're a couple watching this evening. In that case, tick carer and patient. Are you a family member or relative of someone with PF? Or perhaps you're a bereaved family member or friend of someone who had PF, or you might be a healthcare professional. So if you could tick that box, I can't. So, but if you could tick that for us, and then the results will be available to us in not very long. Be wonderful to see what the mix of our nearly 100-strong audience will be tonight. And hopefully you can see what I can see, but the majority, just under 30%, 40%, 30 of us, 30 of you, are patients, followed by 32% patients and carers, so couples watching it together. And then we've got healthcare professionals, 9 of you watching, that's fantastic. Carers, 5, and relatives and bereaved family members, that's fantastic. So the majority are patients and carers. And then I think we've got another poll that will ask a few more questions. And we'd love to know, have you already taken part in pulmonary rehabilitation? So I think that will help Lorna and Ron just think about, you know, who's watching, what your experiences have been so far. And it might shape some of the questions that you ask us. So, and hopefully everybody has ticked one of those. It would be great to see how many of you have already accessed pulmonary rehab. And I guess I'm already starting to think, is that before COVID or during COVID? And just waiting for the results. That's great. So just over half of you have already taken part in pulmonary rehabilitation sessions, but half of you haven't, just under half. That's really helpful. And finally, one more poll I think is coming your way. So the important question is actually, how much has it helped you? How much do you feel like exercise has helped you with your condition? So all the way from strongly agree down to disagree. And I guess that's the whole point. Do you feel that the rehabilitation, the pulmonary rehabilitation sessions that you've already participated in, have they made a difference? And it'll be interesting in your questions that you ask later on in the session, as whether it's about getting the most out of exercise. So it'd be good to know what the results are. And I can see. Brilliant. So 40% or 22 of you strongly agree. 17 of you or 31% agree. And the rest are neutral. So 16 people or 30, just under 30%, 29% of you have maybe not sure of whether it's made a difference. So I think that would be interesting to pull out from Lorna. But now, so we know a bit more about you. We've introduced Ron and Lorna, and so it's absolutely my pleasure to hand over to the both of them as they talk about pulmonary rehab exercise explained. Over to you, Lorna.
Okay. Thank you very much, Louise, and thank you for the plug about Pulmonary Rehab Week. But as far as I'm concerned, it's Pulmonary Rehab Week every week. But thank you for the invite tonight, because pulmonary rehab is something both Ron and myself do feel very passionate about. And we're going to tackle tonight's talk from myself being the service provider and Ron being the service user. And we're going to go through what pulmonary rehab is, why you should do it, and how you can get referred. But looking at the poll views, I'm actually maybe preaching a little bit to the converted. However, let's get started with what pulmonary rehab is. So this was a definition put together by the British Thoracic Society back in 2013. Lots of words in here, and I'm going to summarize it for you in one sentence. It's an exercise and education program for people who've got chronic respiratory disease. If there is another word I would pull out from it, it's interdisciplinary, because it's not just run by physios or not just run by nurses, but we have a whole team of multidisciplinary professionals that impart their knowledge onto patients and their families to help give you some empowerment into managing your condition in the long term. So I haven't got very far into my presentation, and I've already mentioned COVID-19 pandemic. And I'm sure this has affected every single person out there and our lifestyle. And in the NHS, this is a huge, big game changer. And particularly in pulmonary rehab, where we've gone from delivering face-to-face sessions where people would come up and we'd have group classes, to now having to do it virtually by using a video link. If I can have, thank you. By using a video link, we use Microsoft Teams, and in the bottom part of the screen, you can see the video link of the patients here. So there's been pros and cons with this. there are definitely some pros to the virtual program. It means you can access this from the comfort of your own home, so you don't have the travel issues to get into the hospital or the venue that's holding pulmonary rehab. The cons, certainly from my point of view, is in the group here, you can see they're positioned quite well in the cameras, but actually to look at posture and exercise technique with some of the patients, if the camera angles are up at the ceiling, it's not so good. So I'm going to bring Ron in straight away here, because Ron, having done both face-to-face and virtual rehab, how did you feel about the change?
Well, as you know, Lorna, I did rehab some 6 years ago, and of course it was all face-to-face in those days. I personally prefer the face-to-face because of the social aspect. I like a bit of banter with the other members of the class and the all-important cup of tea at the end. I find with virtual meetings, online meetings, people just say goodbye and log off. Whereas if you remember in class, in the gym, we used to have a cup of tea and sit around and have a chat for 5 or 10 minutes.
Yeah.
I do understand that some people who find travelling difficult must prefer the virtual online meetings, particularly if they're using oxygen and they've got to make sure they've got an adequate oxygen supply for the travelling and whilst they're in the class. So, I mean, my personal opinion is I prefer the face-to-face.
Yeah, and I take your point about the banter, peer support, and whatever you want to call it, because there is that little bit of satellite delay. Sometimes it's very easy to miss on what's been said, and especially if everybody wants to talk at once, or if a dog flashes in front of the screen or something like that. But it can be quite amusing. But there are pros and cons, and as I say, I think the future is probably going to be doing a bit of both. So I'm just going to move on to the next slide. So what does a typical program look like? And this is typically what it would consist of, is attending for a supervised exercise and education session twice a week for 6 weeks. So exercising twice a week is better than nothing, but it's not enough to get you physically stronger and fitter. So hence the need for exercise diaries and doing some exercise and walking homework. Before social distancing, certainly in the area that we used, we had groups of up to about 12 patients. But now with social distancing, that amount is less. And I think that's where the need probably to have both face-to-face and virtual happening at the same time. And there's often a mixed pathology. So it's obviously not all patients with pulmonary fibrosis. You can have patients with bronchiectasis or COPD. The venues where rehab tends to happen is usually in a hospital outpatients or in the physio department, or certainly community leisure centres are getting very popular because they've got quite big rooms, so it lends itself to getting more people into the programme there. And the multidisciplinary team is really crucial at delivering these educational sessions. And I'm going to talk a bit more about that later on, so I won't go into that too much at the minute. And referrals tend to come from chest physicians, nurse specialists, physios, GPs. So on the next slide. Okay, so we've talked what pulmonary rehab is. So why should you do it? And in order to look at why you should do it, I think we need to look at the problem behind most of the reasons why people can't do either the things they want to do or all the things that they used to be able to do. And that's usually breathlessness. And when breathlessness first rears its head, it understandably makes people very anxious. So they avoid doing the things that they know is going to make it worse, which is usually activity related. So they become more inactive. As you become more inactive, you become weaker. So now you've got muscle weakness and a compromised respiratory system. It's a really poor mix here. So what the pulmonary rehab program can break the sort of vicious breathlessness circle that you can get into. And if we can reduce breathlessness in everyday life by increasing your exercise capacity, that goes a long way to help your anxiety that you get over breathlessness. One thing I need to say here, though, is one thing that pulmonary rehab cannot do, it cannot alter the lung mechanics or your lung function. But if we get your arms and legs stronger, you will get more miles to the gallon. So Ron, I don't know if you remember how much a feature of breathlessness was about instigating your pulmonary rehab referral.
Yeah, well, breathlessness was the trigger that made me go to the GP in the first place. Although at the time I blamed my heart from previous heart problems rather than lungs.
Right.
But the GP soon put me right on that. I was a bit slow because having already lost 2 sisters to pulmonary fibrosis, it didn't dawn on me that I'd got the same thing.
Oh, okay.
Because I didn't know about familial in those days. So it was breathlessness that certainly triggered my journey. But you say about the deconditioning cycle, I've certainly experienced that, and it's quite noticeable if you stop exercising or if you stop raining for a few days and you don't go out for a walk. The next time you go out, you certainly notice a difference.
And a fiver in the post to you, Ron. Well done for saying
Thank
the
you
right
very much,
thing.
Lorna.
Anytime. Okay. Just
Checks
going to
are accepted.
Okay. Moving on to the next slide. So when you come up for your assessment before you start rehab, expect to do some sort of exercise or walking test. So some people do 6-minute walk tests where you can walk at your own pace, up and down usually a 10-metre circuit. I use a bit of a harder test. I use what we call the incremental shuttle walk test, which is a walking test that starts off slow and it gets progressively faster. So the walk test is good at looking to see, A, how far you can walk, but actually seeing if we provoke any oxygen drop. And this is really important because if your oxygen level does drop, then you should use oxygen and you will do better if you use it as well. So not only is it an assessment, but we can also work out, do you need to use what we call ambulatory oxygen? The other thing we get you to do is we get you to rate your score of breathlessness because only you know how breathless you are. And we use a 0 to 10 score. So we don't expect people to get up to level 10. And in fact, when we're exercising, we would say maybe a cutoff of 5 is a good score to aim for. The other test that I get people to do is the 5 repeat sit to stand, which I like a lot because it tells me not only about muscle strength, but it tells us a bit about coordination and balance. And this is something that gets worse as we get older. But during this assessment, when we've looked at your walking test, we can actually gauge a bit of a walking prescription for you. So as soon as you start your assessment, that is as soon as your therapy and your pulmonary rehab starts there. So Ron, I know it was a long time ago, but can you remember how your assessment session went?
Yes, I can. I got this nice letter from somebody called Lorna Brown.
Oh, very good.
Inviting me to take part in a rehab course. So I made an appointment and I think I saw, is it Marion?
Yes, that's right.
Yeah, Marion. And she interviewed me, asked me all sorts of health questions. And then we did this infamous walking test where you walk over, I think it's 10 meters.
It is, yeah.
And you have to turn on the feet.
Yep.
And it gets faster and faster until you collapse with exhaustion.
Yeah,
or
not. Yes, that's
or
right.
not. Yes. In fact, you stopped us before then.
Yeah.
But we all grew to know and love that walking test when we were doing face-to-face maintenance classes.
That's good. Well, let's hope you love it the next time we do it, Ron.
Yes, save it up for me.
I will do. Okay, thank you. So moving on to the next one. So when you actually start rehab, the exercise session to me is what really is the therapeutic engine that empowers the whole rehab process. So the exercise is designed to make you fitter and stronger. So we use, we used to use dumbbell weights when we did face-to-face. We use resistant elastic bands now virtually. And we have a sort of exercise circuit where you work your way around, spending a minute at each exercise station. And of course, when you exercise, that gives you the opportunity to challenge your breathlessness, but you're going to be in control of how much you challenge your breathlessness. And of course, you've got hopefully that feeling of security that you're doing it in a controlled environment as well. And one of my mantras is breathlessness, healthy, not harmful. Because after all, when we all exercise, we get breathless. You expect to get breathless. And if you look at Mo Farah here to the left, you can see here he's done his exercise. He's an elite athlete. He's got fantastic lung capacity, great pair of lungs, but he gets breathless when he exercises. But not only that, if you look at the position that he's in, I think he's just completed the London Marathon in this photograph. He's leaning forwards, fixing his arms on his legs, which fixes his upper chest muscles, which actually can work a different way to support his breathing muscles. And this is something that respiratory patients do. So the only difference between Mo Farah and Ron Fish is Mo Farah's just done a marathon in under 2 hours. Ron, how do you feel about being compared to Mo Farah?
Well, I can see the similarities, Lorna, but I usually do a marathon in about 2 years.
Okay. And how do you feel about when we talk about breathlessness being healthy or not harmful, just trying to get a bit more of a positive mindset around it?
That was something I felt was very important to learn when I started rehab. Because when you get breathless, it's very easy to go into panic mode. And then, of course, you start panting and gasping, and it gets worse and worse. So I think learning to put yourself in a recovery position and breathe in and out slowly, I think was a great help.
Okay, brilliant. Thank you. Okay, so I'm just going to move on to the next one. So the other aspect of pulmonary rehab is the education talks. I like to think of them more as discussion sessions, really. And this is what we do. So obviously, pulmonary rehab programs up and down the country will have a slightly different bias on things, but we talk about exercise, why you should bother to do it, goal setting that you might want to achieve from doing pulmonary rehab, a bit about where the lungs are, how they work, what's gone wrong with them, the pathology in your lungs that's given you the symptoms that you do, which I think goes a long way to help with your understanding. We do breathing exercises for clearing phlegm from the chest and to help get your breath back. The pharmacist talks to the group about drugs and medication and inhalers if they're on them. We do a session on recognizing how, if you've got a chest infection and what you should do about it. And we also do a session on oxygen therapy because there's a lot of myths around oxygen. So oxygen is for people who've got a low oxygen level because they will do better. It's not necessarily for people who have just got breathless. People can be very breathless but actually have quite a good oxygen level. The dietitian, you may or may not be pleased to hear, would actually like you to be carrying a bit more weight, so you've got that bit more of a buffer zone if you're unwell and you become maybe more breathless and it's difficult to eat and drink. The psychological wellbeing service is a fairly new intervention that we have, that goes a long way to help people with long-term conditions, and they can offer one-to-one sessions as well as group sessions for people. Our Singing for Breathing coach has actually been, I think, a real success. She doesn't necessarily approach it from singing for breathing, but goes through a lot of different relaxation techniques and breathing techniques, which is really useful. And the occupational therapist gives you some great ideas how you conserve your energy. And I always think a really good example of this is when you come out of the bath or shower, it's a towel wrapped around you, sit down, wait 5 minutes and you'll dry, and you don't have to do all this energy wasting, flapping your arms around trying to get yourself dry. Obviously, when you finish pulmonary rehab, you may want to look at some other exercise or support groups that you can go to attend, so we can talk about what's available in the area. And then at the end of the session, we repeat those lovely walking tests again, just to see where you are and hopefully look at the improvement. Ron, I know you didn't do all of these sessions, but can you remember which ones you found maybe the most appropriate and the most useful for you?
I found breathlessness management very useful. The pharmacist talking about managing your medications, because a lot of us have other ailments as well, or other conditions, that we take various types of medication, and it's useful to know sometimes if you need to space them out or take them with food, without food, in the morning, in the evening. So that was very useful. Diet I found useful because of the effects of some medications, and perhaps you need to vary your diet to mitigate those effects.
Yeah.
I don't think we didn't do the psychological well-being, did we, in those days?
No, they didn't have that in your day, Ron.
No. And the singing for breathing, we certainly didn't do.
But it's quite nice that, you know, the educational sessions are evolving a bit depending what's
Yes,
available
indeed.
at the time.
Yeah.
And it's
But-
interesting to hear what you find useful, but that doesn't mean that's necessarily what everybody's going to find
No.
useful. There's always a
I
different
mean,
taste.
oxygen, for instance, I was far from needing oxygen in those days.
Yeah.
So that wasn't of much interest to me, except for the future. But the other thing was occupational therapy gave us some very useful tips about managing daily tasks, as you say, shower, for instance, and thinking about how many times you need to go up the stairs in a day.
Yes.
Think ahead.
So it's
if
all
you need
about
something, go up for two things rather than one.
Yeah, I think that's a good point. It's about saving your energy and breath to do the things you want to do rather than the things
Indeed,
you have
yes.
to do.
Yeah.
Like your exercises and walking, Ron.
Mm-hmm.
Okay, great. Thank you. So we've talked about what and why, and the other main reason about why you should do it is there are some real proven benefits of pulmonary rehab, and not surprisingly, an increased exercise capacity and walking ability is one of them. And if you know more about your condition and how you're going to manage your condition, there's a possibility that you may well be able to avoid hospital admissions and lessen your respiratory symptoms, of which anxiety and depression certainly may be a feature. But apart from, you know, just improving how far you can walk and your exercise capacity, but just day-to-day activities, if they are much easier to carry out, I think you'll find you have an improved quality of life with that.
Mm.
So how do you get referred for this marvellous therapy? So I think the most common route is probably through your respiratory specialist nurse or consultant. That's certainly where the bulk of referrals of patients that I see. Your GP can be a good point of contact, or you can ask at your local hospital. They may know what's in the area. If you're online, you can check hospital websites. They might have it mentioned on there. If you do speak to somebody about it, ask them about waiting times, because as Louise was talking about at the start, you know, I think now things have opened up. waiting times, unfortunately, for pulmonary rehab have got longer and longer. And also ask about the format of the programme, if it's going to be face-to-face or virtual or both. And obviously, if you're doing it virtually, you will have to have access to your IT stuff. Make sure, though, that your assessment is done face-to-face, because what is vital is that we know what your oxygen level is. So to summarise, sadly, as we get older, we lose muscle fibres steadily after the age of 35. And along with that, we lose our lung and heart capacity. And I think the effects of this is more profound if you've got a long-term condition. But the good news is muscle strength can be improved regardless of age with exercise. But I have to reiterate that exercise can have no impact on your lung function. But if you think, well, I've got impaired lung function, I can have impaired lung function with weak arms and legs, or can have impaired lung function with strong arms and legs, where I'm going to get more miles to the gallon out. So I would urge you, for those of you that haven't done pulmonary rehab, to consider it as a means of not only improving your exercise capacity and your walking ability, but looking at ways at improving your breathlessness management. And it may also enable you to feel more empowered to manage your condition with the support of your healthcare team and from other patients within the group. So if you haven't done it, try to get referred to your local programme. I don't think you've got anything to lose. Ron, do you think there's anything else we should add at this point?
Well, you could mention it's sometimes useful, and some patients enjoy having their family members with them.
Absolutely, absolutely. And in fact, the photograph that you can see on the screen there, we've got quite a few members of the family that have come along. Because, of course, the disease doesn't just affect the person with the disease, it's got knock-on implications for the family too. I think that's a really good point.
Yeah. Do you want to mention the maintenance class?
So I think maintenance classes are becoming more and more popular. And ours has been running for how long, Ron? You've been at it?
Well, I've been doing it for 6 years now.
That's why I'm so tired, obviously.
I'm a perfect pupil, I think.
Okay. And it's proved to be really successful. When we were able to look at people's walking tests, it seemed to be doing that. It seemed to be maintaining their walking. Of course, since we've gone virtual, we haven't been able to do that. But I'm hoping to get people back face to face so we can have a look at your walking tests again.
And we will look forward to it.
Good. Lovely. Okay. Thank you.
What a great session. Thank you both so much. And Ron, I will never look at you in the same way now that I'm comparing you to Mo Farah. So
yes, yeah. He's a bit slower than me, actually, but...
So that's brilliant. Thank you both so much for a really clear and helpful presentation. We have some fantastic questions coming in. Before I hand over to the questions that have come in, and they've all been very kind to you. There aren't any mean questions for you.
Good.
But I guess, Ron, how you've been on the pulmonary rehabilitation course, you're more knowledgeable, you've got information about, the courses and the exercises. How do you keep your motivation up after the course is finished?
Well, it's just, I'm afraid I'm just frightened to say no, and I don't want to continue. No, I really enjoy the sessions. I can't wait to get back to the face-to-face ones. And I'm fitter. Well, I feel I'm fitter anyway, apart from the breathlessness. That's just the way it is. But yeah, I know it's a matter of enjoying it. And I love the banter between the other members and the social aspects. And we have a great time. We enjoy an hour.
Yeah, we do. We do.
And Lorna, just a quick question from me in terms of, you know, how much do you share your expertise? You have a wonderful following with your pulmonary rehabilitation classes at Papworth. Do you share your learning with other healthcare professionals, helping others to you know, learn from your experiences as well?
Yeah, I mean, I think there's actually quite a big base of pulmonary rehab. Certainly in the east of England, there's an East of England Pulmonary Rehab Forum. And certainly when I think back to when we started the maintenance, not many people were, or not many groups rather, were seeing pulmonary fibrosis patients, but actually that's something that has taken off much more. And because initially the model of pulmonary rehab was set up for COPD patients, but now we're seeing, I think actually it'd be better to call it breathlessness rehab, because actually we're seeing a whole variety of respiratory conditions, and now even looking at heart failure patients as well.
Okay. So I'm going to go over to questions from our audience. So someone asks, whilst doing pulmonary rehab, what is a safe oxygen and heart rate? Is there a single answer to that?
I would say when I'm walk testing someone, if their oxygen level drops below 85%, that would alert me to think that they probably need some ambulatory oxygen. But I think when you look at that, you've got to look to see how long they desaturate for. So is it just, you know, down for a second and they're back up to 88, 89%. So I would say a sustained drop of 85%. The heart rate, rightly or wrongly, I'm not that bothered about because I'm more tuned into what their oxygen level's doing.
Okay, thanks, Lorna. And then I've got a question about the education part. It does come up particularly for PF and IPF patients who are perhaps sharing an education program that's based for, you know, people with asthma and COPD. What's the reason for that, and how, you know, is there some good practice where you separate patients? You know, how do you manage that effectively?
I think everybody just has to be a bit open about this. And, you know, if in the group I have got 60% of people with IPF, 20% with bronchiectasis, 20% with something else, not every educational session is going to be just right for them, but you try and spread it so that everybody will get something out of it. And it's a difficult one. But, you know, I think there are maybe a few pulmonary rehab groups that are solely for IPF patients. But actually, I think there's more benefits than not from having a mixed group. I think it makes it more the richer, actually.
Yeah. I
say, Ron.
The individual person takes what they want out of the talk relative to your own disease.
Yeah,
that's what I felt anyway.
Yeah, okay. So someone asks here, I'm in the progress of doing pulmonary rehab at the minute, but it's an initial meeting, then 1 or 2 weekly phone calls to check progress, and then a return in 6 weeks. How often should I or can I access courses? Because I would much rather do face-to-face groups. But I guess that's dependent on the provision that's available.
Yeah, so that sounds to me like something that was done maybe from COVID, that you know, people weren't able to either come into the hospital, or maybe they didn't have the facility to do online stuff, because our guidelines for pulmonary rehab says actually they should be doing 2 supervised exercise sessions a week. So if you're doing them on your own at home, that's better than nothing, but it's not really what the guidelines are saying. So I would recommend that you carry on, but then say, actually, when things get back up and running, I'd like to be into a face-to-face program or a virtual program, because I think that's very difficult to do on your own at home.
Yeah, I think so.
Yeah, I find it difficult to motivate myself on my own at home, apart from walking. But don't tell Lorna that, Louise.
Well, I can see what you do, Ron, when you're sorting out all the things behind you when you're procrastinating.
Well, I took up painting during lockdown.
Oh, wow.
Yeah, I won't show you any, but
Are you talking about pictures or walls, Ron?
no pictures,
Oh,
Laura.
okay.
I was inspired by, I don't know whether you've heard of a guy called Bob Ross.
Yes, I've seen him on the telly.
I was just inspired by his program, and I thought I can do that.
Oh, that's so good.
Well done, well done.
Someone that's achieved something through COVID. That's always good. So someone asks here, if one's lung capacity appears to have fallen from a level 6 to a level 3, how would this affect my rehab? Should I wait for the results of heart and lung checks, or should I try and follow through with a reduced exercise program?
I think you should try and follow through, because, you know, if I have a room full of people that have all got the same lung function, they will all be able to do different things. So yes, lung function is certainly a good maybe predictor of what you can do exercise wise, but it's dependent on lots of other things as well. So rather than wait, I would get in there and get started. So, you know, we're talking about nobody is too old or too young, and I think the same thing's true for lung function. You know, we just try and tailor make it for people depending on what level they can do.
We all work to our own levels, don't we?
Yes, yeah. I think that's one thing that's hard about the virtual, because everybody has to start and finish together rather than everybody coming in and doing their own thing. So some people might be inclined to push it just a little bit too hard, and other people can maybe, you know, not push it as far as they need to. So it's, you're quite right. People need to be working at their level, not anybody else's level. It's their level.
And Lorna, what would it feel like or look like if you were working too hard? What does that manifest itself as?
So we sort of use the Borg score of breathlessness to get an idea of how hard you're working, because it's how your breathlessness feels. So this is this 0 to 10 score. So for example, 3 is moderate, and I say to people that usually means you can feel that you're breathless, you're aware that you're breathless, but you can still talk. Number 4 is somewhat severe, so now you can only talk in short sentences. And 5 is when you can only, and that is your cut-off point. I don't want to see people working any harder than that. So I'm not looking at their heart rate, I'm looking at their breathlessness. I might be looking at their saturations if I knew it was somebody who really dropped their oxygen level down. What do you think, Ron?
Yeah, I totally agree, yes. I mean, you can almost gauge your own level anyway, can't you? Or I found I could anyway. And if you got too breathy, you could slow down.
Yeah. I will say to people, this is another one of my mantras: stop before you have to, because if you wait till you have to stop, that's going to take you so much longer to recover, and you won't be working as well if you're pushing yourself to that point physically. You know, you're more at risk of falling. So stop before you have to.
There was of course a certain colleague of yours, Lorna, that didn't allow us to slow down.
I think I know who you mean.
Oh, you can't mention names on here. She might be
I
watching.
can't mention the name, possibly.
Yeah, she was a lot of fun, though.
Oh, she was, yes.
Someone asks again a bit more about the actual running of the program. So it's twice a week for a period normally of around 6 weeks, isn't it, Lorna?
That's right.
And then someone asks, are they always during the day? Because I work full time.
I think most of them are. I haven't come across one that's in the evenings. I don't know if whoever works full-time, if they've got an understanding manager that would release them for this therapy that's actually going to improve their function. I think it would be time well invested.
That's good. I will mention who asked this question. This is Steve.
Oh, no.
He says hello to both of you. And he says, like Ron, I think a key benefit of dedicated PR for PF patient courses is the opportunity to meet up and offer mutual support. But sadly, there aren't many dedicated courses around the country. So, and why not? And he says that I am a graduate of your course.
I remember him being there.
So
I don't know is the answer to that, really. I think there's a lot of pressure on pulmonary rehab, and certainly the IPF patients have come in to widen up and increase that patient waiting list, and it's very hard to. It's maybe going to be hard to either prioritise PF patients or to do a course singly. There are some around.
I quite like the mixture, actually. I quite like the different people there, and you can talk to them about their own problems.
Yeah.
Someone asks, they say, is it possible to do a rehab course for a second time? So once you've done it, can you go back and do it? And are there any good online training options that you can do yourself or that you can look up? I mean, I know that the British Lung Foundation do have some exercises online, and it's definitely worth looking at their website. But can you do rehab again?
Oh, absolutely. And I would say, you maybe don't want to finish a course and then enroll straight into it. You probably want to have at least a 6-month break before you start again, because of course you've got the education to go through again that you may or may not necessarily want to tap into. And I agree, the BLF have got some good education exercise videos on there. And I think one thing the COVID experience has taught us all is how to try and use a camera and increase our IT skills a bit. And certainly we're looking at trying to provide maybe some exercise videos on our hospital website. And I'm sure we are not the only hospital to be doing that.
Question from me, Lorna. Do you offer the maintenance class to everybody that goes through rehab? Or is it only suitable for some people?
When we're doing the support groups, we mention the maintenance class, and a lot of people want to take us up on the opportunity of it.
Mm-hmm.
I think when it was only face-to-face, surprisingly enough, I think we're going to get more recruits if it's virtual, because it's going to be easier for people to attend. And of course, the problem is, as the group gets bigger and bigger, it's going to be difficult. We're going to have to split into two, or we're going to try and find a way around that.
So someone asked a little bit more about those maintenance classes, Lorna. Can you elaborate? What do they look like?
Well, they're for pulmonary rehab graduates. Now, because numbers are tight, I only have Papworth pulmonary rehab graduates at my Papworth maintenance class. And when they were face-to-face, it was a little bit of a free-for-all. People used to come in and I would more or less give them a free hand to do whatever they wanted. Ron, used to like them, didn't you?
We used to work to the chart, didn't we?
Well, some of you did. A lot of it was variation on a theme, I have to say. And actually, that is another good thing with the maintenance. These guys are working really hard at maintenance now. I think, it's a bit of a standing joke with the physios. We say, oh no, who's going to do the exercises today? Because they are working really, really hard. So that's been a good thing about it, definitely.
What would you say, Ron? What do you think about the maintenance classes?
Well, I love them because I've been doing them for 6 years now. So, yeah, Nobody makes me do it. I just do them for pleasure. They're really good. It's a really good exercise session for about an hour, isn't it, Lorna?
It is. It's an exercise session that always makes me smile. I can't help but leave with a smile because there's always something to laugh about. So actually, it's an exercise session that's very uplifting for everyone.
But it's, you say it's a free for all, but it's not a free for all because it's quite structured, isn't it?
Oh, yes, the virtual one is, but when you came up for the face-to-face, it was a bit of a free-for-all. There wasn't quite a fight over the treadmill, but there could be. And we had to do a bit of policing. So I actually think having more of a structured programme is probably better, do you think, Ron?
Yes.
Yeah.
I mean, you could continue that programme face-to-face as well.
Yes. And I think probably we will do both face-to-face and the
Sure.
virtual at the same time. But the people that come face to face will get the Tunnock's tea cakes and caramel wafers with a cup of tea.
That's most important.
Well, that's why you do exercise, isn't it?
It is, yes.
Chocolate and a cup of tea.
Absolutely.
So someone asks, really importantly, can I do pulmonary rehab if I'm on oxygen?
Of course, absolutely. And because you're on oxygen, that is your tool to enable you to do something. It's there to support you. So it's not there to label you as disabled. It's your tool to enable you to do things.
Okay, I'm just reading through these questions. I'm just looking at, someone asks about perhaps other forms of exercise, something like Tai Chi. Are they ever included in pulmonary rehabilitation courses?
Not as far as I'm aware. I think Tai Chi would be a great form of exercise because it's fairly slow impact, but you need to have quite a lot of good core support, and you're moving out with your center of balance. So you're having to work your balance muscles a lot more. And because you've got to memorize all those moves, it's good for your cognitive function too. So Tai Chi would be excellent. And there are certainly, or there used to be, some community Tai Chi classes that patients could access.
Yeah, that's something we haven't mentioned much, Lorna, which the balance exercises we do as well.
Yep. Yeah, so I think with the maintenance class, we divide it between strength training and balance training. So they do a strength exercise, then a balance exercise. And then the balance exercise on the face of it might look quite easy, but actually they're not, are they?
No, they're not. I keep falling over.
Yeah, never mind.
That might be the gin that you have, Ron. Someone asked, how would rehabilitation work for someone who struggles to walk a short distance before feeling breathless?
Well, I mean, I used to say I wanted people who were going to be able to walk at least 20 meters before they could come into pulmonary rehab. But actually, I've had one patient who was paraplegic, who actually had pulmonary fibrosis as well. And it was amazing because obviously we couldn't do the same sort of exercises, but he'd do trunk and upper arm exercises and got to learn a bit more about breathlessness management. So I'm inclined to say that, no matter how little you can do, you probably got something to gain. And in fact, sometimes the less you can do, that bit of change is a big change.
That's really helpful. And someone asks, can caregivers also attend PR to help understand how to support their loved one once the course is finished?
Well, that is something that we would always have advocated. And now, of course, with social distancing, face-to-face, you're probably not able to do that so much now. But you could in virtual programs, absolutely. The only thing you have to make sure, which we do with every patient, is that they're happy for other people to see them on screen. So we need to make sure that their relatives are happy to be seen on screen as well. And certainly if they want to interact on the discussion sessions too. But yes, I think that's something we would really actively encourage.
There's a few questions here about the balance of the education and exercise programme to COPD patients versus PF patients. And this is coming back as a theme. Is there anything, would it be possible to, Lorna, you talk about, you balance the sort of education based on the patient?
Yeah, I mean, I think we sort of modified our educational programme from the COPD model actually long before the IPF patients came in. So, for example, smoking cessation would be something that they may well involve in COPD educational programmes. That's something that I took out because actually most of the patients that I saw had given up smoking, or the ones that still were smoking, they were actively trying to deal with it. So I don't know, I suppose that maybe I think maybe the pharmacist talk, which used to be geared a lot around inhalers for the pulmonary fibrosis patients, if they weren't on inhalers, maybe found that a bit useless. But then their discussion sessions, and we encourage people to make them discussion sessions and to ask questions that are more specific related to them. And certainly our healthcare professionals that run it are much happier to run a discussion session than deliver a lecture.
Right. I've got a couple of, I think this is going to be maybe one of our last questions. We're coming towards the end. It's about, how soon do you think patients should be offered pulmonary rehab? And somebody asks, again on the same lines, is there a set of criteria, in order to access pulmonary rehab?
No, I think that goes back to, is anybody too good or too bad to benefit from pulmonary rehab? I think maybe if you're too good, there might be some other avenues that you could explore. So I know Ron and I have had this discussion, and Ron has admitted to me he isn't a natural athlete, so didn't really do a lot of exercise beforehand. So depending what you're like, if you're somebody, we're all different, we're all made up differently. If you're somebody who likes to exercise, and if you've got very mild symptoms, you may well just want to go to the gym or go to another exercise class. But what pulmonary rehab does offer you, it's more than just exercise. We're looking at breathlessness management. So if breathlessness is at all a feature, I would encourage you to do pulmonary rehab.
I think, Lorna, it's useful to do the education side of rehab as soon as possible after you get diagnosed, because it is comforting to learn about your disease.
Yes.
Because there's a lot of mystery when you first get told it's 3 to 5 years. I mean, you're in shell shock, and going to rehab I found very helpful.
Good.
I think I am going to leave Ron with the last word there. So thank you both so much for your really helpful talk. We've had over 100 people watching this evening, and over 35 questions. So really active and engaged group. You've been really clear, really concise and helpful in your answers. And it's hugely appreciated by us and the audience. Thanks to the brilliant AVT, BI, 11 London, and everyone for coming this evening. You've been wonderful. We look forward to seeing you all in 2 weeks. Thank you again, and goodbye.